when we're walking over the studio, is you're going to Vegas for it's like a longevity conference.
Yeah, so I'll be in Vegas for American Academy of Anti-Aging,
Yeah.
which I've been a member of since 1998.
Phew. So basically, when it started.
A couple of years after it started, I've been a member. Yeah.
Yeah.
I think they celebrated 30 years or something.
Okay. Did you ever anticipate that was going to be a part of your career? Like longevity, wellness, because it seems like, again, it seems like these are almost separate fields, like medical field and longevity, wellness field. Again, I feel like, anyway, I could be totally wrong because it's not my field. I feel like sometimes they butt heads, or there's conflicting advice sometimes between medical professionals and a wellness clinic or something like that.
I think today it's easier to see those differences because when we didn't even have the word longevity.
That's what I mean.
Like 10 years ago. I mean, it wasn't even in existence. You know, so nobody was talking about Healthspan and lifespan and things like that. And as I said on the way over, as a member of the American Academy of Anti-Aging in 1998, we didn't even have one published clinical trial on any kind of animal or vegetable or insect that even expanded the normal lifespan. We had nothing.
Wow.
It was all just
in
a hope and a
1998.
dream. It was all hope and dream. And
Wow.
it wasn't until just about 10 or 15 years ago did we start to see that there were actual ways to expand lifespan. And of course it starts with fruit flies and yeast and things like that.
Sure.
And then it goes to rats and so forth, and rabbits and dogs, and now everybody's talking about lifespan and health span.
Yeah. No.
So,
kidding.
but I think what I liked about that particular conference is that it was a little bit outside of the traditional medical path, which I enjoyed having kind of a different exposure. I didn't know at that moment that all the lies I've been taught in medical school, things in terms of, cholesterol and statin medications and, even antibiotics and pain medications and things like that. I mean, look, I was there in the hospital when the drug reps were coming in and telling us that synthetic opioids were not addictive.
What?
They were telling us that this is less addictive than than heroin or whatever. And so
thank the Sackler family for that.
The OxyContin dilemma and epidemic. Was really started at and my job as an intern in the hospital was to basically stamp out and write out all of the narcotic pain medications for all the patients that were operating on that day.
Wow.
And it was just a stack. And these patients would leave with a bag of narcotics, after whatever. Like a hernia, appendicitis, or whatever.
Just over-the-counter heroin, basically.
It was and they were telling us it was safe and not addictive, and here, use this little card for the pain scale. So it's a smiley face on this end and a frowny face on this end.
Yeah.
And so, how are you feeling today? And so if you're a frowny face, you get a script.
Wow. That's crazy.
We up your medications. And so that's what was happening. And so I don't think I understood that. I mean, now looking back,
sure, we
know what kind of, devastation that's caused.
Absolute devastation.
Throughout.
Yeah.
So, but the A4M always, American Academy of Anti-Aging, always had kind of a unique approach.
Yeah.
They always brought in alternative medicine stuff, complementary medicine. There were, I would say, technical partners, in the expo, talking about nutrition. What did I learn about nutrition in medical school? You could write it on the back of a matchbook with a crayon, honestly. I mean, it was like, here's how to calculate a diabetic diet. And that was the end of it.
Wow.
So I was learning all these things by osmosis, just being there, seeing it, and talking to those people. And that really became the tribe that I was attracted to. Well, and then now that is the anti-aging, longevity, biohacking world. That's what it's really turned into.
Hey, good for you, man. I genuinely appreciate that from somebody who has been a patient for a medical professional to care about that type of stuff. It's so jarring sometimes when I go into a doctor's office and the person giving me like health advice, not to be crass or rude, is 120 pounds overweight. Hair is scraggly and they look greasy and gross. I'm just like, how are you? I know you got a degree and stuff, but I don't know if I completely take all your advice seriously, because there's a clear discrepancy between how you take care of your body and what you're telling me to do. It's hard for me to justify the gap. You know what I mean?
Absolutely.
So
I'll tell you a
appreciate
story.
it.
I was in my general surgery residency. Pretty sure it was at either Beth Israel or Mount Sinai, and my chief resident was in between coronary vascular disease operations, coronary bypass treatments and procedures, smoking cigarettes in the stairwell.
That is insane.
I mean, he was a chain smoker. Yeah. In between, he would do surgeries.
Yeah, right.
Once in a while, like when he put down the cigarette, he'd go and do surgery.
Yeah.
I mean, literally, that's what it was unbelievable.
Yeah, that is insane. Do you think
A heart surgeon.
Yeah, a heart
thoracic surgeon. Yeah, thoracic surgeon operating on lung cancer, heart patients.
Wow. Do you think that there's like a pendulum shift that's happening, like a swing the other way now?
Oh, 100%.
Yeah.
I mean, you can see. I mean, look at what we got. We have RFK Jr.
Right.
I mean, who had risen in prominence, after exposing everything that Fauci had done in his past. I mean, one of the most horrific books to read before bedtime ever in the history of the world is The Real Anthony Fauci.
Yeah.
But it tells the story, and it's well researched and well footnoted. And
that's the crazy part.
referenced.
The crazy part to me is like, how are people not talking about that more when it seems like if the information in that book were false information, that he would have been like, he'd be in lawsuit after lawsuit after lawsuit for like blatant for libel, for blatant disinformation about some defaming somebody else's character. None of that's happened.
Correct.
That's mind-blowing to me, that this is the person that was in charge of public health for an entire nation during the pandemic, and nobody was asking questions about that. Nobody was like, hey, what about this though?
Well, remember during the pandemic, there were forces at play that were suppressing the people who were asking questions about that. So I have a lot of colleagues who were deplatformed, a lot of friends in the medical profession.
So dangerous.
Who were taken off of YouTube, their information on Meta, whether it be Instagram, Facebook, canceled, shadow banned on the algorithm, so they get like 2 likes instead of 2,000 or 20,000. And now we see them able to kind of talk about it more. And of course, Elon with X.
The acquisition of X was insane.
So
the Twitter files were mind-blowing to me. To see the just blatant censorship. Proven blatant censorship. And again, nobody talks about this. You have to listen to podcasts, and then all of a sudden you're like fringe and a conspiracy theorist when you're getting your information from a podcast instead of a news source.
You had to watch a video on Rumble? Yeah, because they don't delete it.
Right. Yeah. Exactly.
But no, I mean, we have to be intelligent, accessing intelligently this information, and assessing it. But the more information we have, the better choices that we can make, and we can filter through this.
Like Michio Kaku says, correct ideas come from interaction with incorrect ideas. And if you never allow those ideas to interact, how do you know which ones are correct? And if you start just censoring an entire swath of information, how do you know that the information that you have is the accurate information? There's no way to actually tell. There's no contrast between right and wrong if you're only allowing one source of information to exist. And it's pretty mind-blowingly blatant.